Morning, everyone. This session we're going to address family planning and awareness policies in Egypt. We're starting with the 4 questions: where we are, where we want to be, and what are we achieving right now, and is it enough or not? Where we are, we find that the fertility rate was dropping steadily until 2008 and started to rise again. You'll find that the Delta and the Upper Egypt have the higher rates, and it drops with the higher living rates. If you look at the family planning devices were highly used until 2008, but then until 2014 it was dropping, and also the unmet demand was rising at the same point. You'll find that the border governed rates and the Upper Egypt have unmet demands, and the utilization rates are rising with the higher education rates. 11% of the wealthiest classes they look for the service, but it's not met. So it's not only about finances, and also there is low demand in Upper Egypt, and also in the border governed rates. In Egypt, women do not use family planning before the first child, and also it's used at a more frequent rate with the frequent rate with the longest marriages. 30% of the women do not use the contraceptives after the first year, either because there are side effects or because women are seeking to have other pregnancies, or they seek other contraceptives. We are targeting dropping of the fertility rate to 2.1. What we're doing right now, and does it achieve the objectives or not? First of all, what we're doing right now is not meeting the objective, because the system of the provision of contraceptives, including the procurement up until the monitoring and evaluations, are not enough. First of all, the procurement of contraceptives, there are monopolistic efforts. There is a limited number of companies, and each one provides 2 or 3 contraceptives, and there is no room for other corporations. The licensing or the registration procedures are very lengthy, and the regulations are in continuous change. And also, there is a limited number of countries that these contraceptives are imported from. What Iran does, it has the largest factory for manufacturing of condoms in the Middle East. There is a lack of financing. We relied heavily on the U.S. aid financing when it comes. We did not also use these finances for the sustainability of these programs. There is no item under the Ministry of Health budget for the procurement of these contraceptives, and it's usually provided in installments, which wastes a lot of money. In Iran, there is a very clear item in the budget, and in Turkey there is an optimal utilization of international aid. Turkey was really keen to utilize all of the international assistance in order to support the sustainability after the finances cut. Recently, in November, we secured a loan from the International Monetary Fund. The loan is really not that big. It's a high-risk loan. The loan is channeled to the neediest governorates. I'm sorry, it's used in Cairo and Alexandria, while the poorest governorates lack the enough or the proper financing. There's also another problem with the procurement. The government and the private sector secure their procurement independently. There is a problem with technicality. The technical committee that sets the technical procedures in the Ministry of Health does not include any of the pharmaceutical experts. It's all made up of gynecologists. The contraceptives in Egypt are taxed despite the fact that it's included on the basic pharmaceutical list, which is usually exempt from taxes. We have two storages for the contraceptives in Abbasiyah, which falls under the mandate of the Ministry of Health, and another one in Shobra, which falls under the mandate of the Egyptian company of pharmaceuticals. The one in Shobra delivers to 22 governorates, while the smaller villages have to get their share from their closest governorate. The most remote areas suffer from the accessibility problems. Service provision. The public service, the public sector itself is not playing its role effectively. You'll find that the public hospitals and the public clinics have lower rates of contraceptive utilization. The condoms were distributed along the cigarettes in Turkey. You have comprehensive health insurance. The mobile clinics also have a declining role from 2013 in Upper Egypt, which is in dire need of these contraceptives. You have the high rates of women complaining from accessibility problems or their inability to reach these contraceptives. And also there is lack of coordination when it comes to service provision. There's a high rates of women getting their service from their private doctors, and as such, the quality of the service could not be assessed. The prices of these contraceptives are not always affordable. You'll find that the drugstores they have a problem. The Ministry of Health puts a smaller marginal profits on these contraceptives. So, who provides these services? Are they the rural leaders or the pharmaceuticals? When you look at the national sector, you'll find that it provided to 1/3 of the to the population. and the NGOs are currently required to pay to the physicians. Formerly, the medical experts were provided by the ministry, and they were paid by the ministry. And now there is lack of training. These trainings were financed primarily by the USAID, but after the USAID withdrew, you'll find that there are lack of training. There is no database for the trainees, and as such, the same person could receive the same training more than once. There is no trainings provided to the doctors on the family planning, and it also does these trainings usually disregard the non-medical staff who actually control the quality of the service provision in Iran. Made sure that there are enough trained personnel to provide the services.
The vice minister of health with the health affairs, they implemented on the center hospital, and then they start implementing this training programs on the other health centers. And actually, they were trained on how to use this contraceptives methods. We have like in the people who provide the service in the medical centers, and unfortunately, we don't have a very well trained doctors. We have lack also in the female doctors, especially in the Upper Egypt. In Upper Egypt, because the women in Upper Egypt, they complained that they don't find a female doctor that they can talk to. This is a problem we face in Upper Egypt more than Lower Egypt, because actually in Upper Egypt, their own mentality, they don't allow a male doctor to insert the IUD. What did they do in Iran? They allowed the nurses to be trained for 2 years, and then they start to provide the family planning methods. Normally here in Egypt, we only provide injections, pills, and IUD, and the IUD. This is Egypt is classified as one of the countries that is using only very few ways of contraceptives. Condoms, we don't use it that much. Actually, the condoms, they are there in the public hospitals. And the female condoms, although it is there, but the percentage is 0. And sometimes for the male condoms, the husband refuse to use the condoms, and the ministry is monopolizing the injection. But actually, the national sector can provide it after getting a license or after getting a permission. And unfortunately, the ministry is not allowing anybody else to sell this kind of contraceptives. So there is a problem, and it is not that available because unfortunately the ministry is not providing this sum, and there is also a problem concerning the rate of because of the side effects of the IUD is very high, so lots of the women, they refuse to use this kind of method. And there is another point concerning to the tradition and to the customs that and to the culture of the women. The women, they think sometimes that this IUD can move from its place, and actually most of the people here are not aware of the sterilization. What Iran did, Iran was always focusing on talking about the different methods and the different ways on the contraception, either for the men and the women, and this percentage concerning the use of the women using the IUD. The women in Iran, they are double double the number of the women that they are using the IUD in Egypt. When the government noticed that the women actually noticed that in Iran that the women are the percentage of the women that they wanted to remove the IUD increased, so they decided not to work in this anymore, and they opened the door for the private sector. Here it is on the other side, it is on the opposite side. The Ministry of Health is totally organizing and is totally doing this business of the IUD. When we were looking at the rate of using the pills, we found that it is increasing, although the rate of stopping using this kind of pills stopped after 1 year of using the pills. So we start asking ourselves why this is happening, and the answer was that the ministry is encouraging this, and actually the users think that this is an easy way, although there is a side effect on the health, and this is because that the pills are prescribed to a wrong age. A high percentage of the women above 35 years that they use it, although it is not recommended if we used the utilizing of this methods of the contraception in the regions, we will find that the injection is considered to be the worst method having side effect, and this is according to the data and to the information of the DHS. They found that the women, they refuse to take this injection because of its side effects. If we see who is using this injection according to the women themselves, we will see in Lower Egypt, the rural area in Lower Egypt, they are the highest percentage using this, and we will see that the rural area of Upper Egypt is also considered to be the lowest rate for using the IUD. We don't have geographical justice for using the different methods of the contraception methods. The most effective parts are in Upper Egypt. Lack of mobile clinics, lack of hospitals, lack of doctors. If we look on the governorates, that they are a little bit, we can say that they are more fanatic, and some of the marginalized governorates, we will find that there are some percentage that they mention that they are considered to have the highest rate. This is why, because there were mobile centers, the establishment of more than 16 health centers, and the literacy for more than 60% of the people living in these areas, and the high awareness to make the people aware not to believe in giving birth to lots of children. This was documented according to lots of studies and lots of researchers. We have other problem concerning the following up and the evaluation. The ministry is putting strategies and plans, but unfortunately we don't have following up, we don't have evaluation. The information and the database in the health center, unfortunately they are collected manually, and after this they are stored on the computer, and after that they will submit it throughout a computer flash to the ministry. The lack of the different means of transportation don't allow the doctors to go to the centers in order to do a kind of following up and evaluation, and this is considered to be one of the main obstacles. And actually the centers that we gather information and database concerning the family planning, and unfortunately here in Egypt and here in the ministry we focus on the quantity and not the quality. We say, for example, if the training course is held or not, but I don't focus on the results. I don't focus on the benefit from this training course. We don't have a database concerning the different methods of contraceptions, except for the pills in the pharmacies. I don't have any database, any information to know what are the needs in the different places and the different areas, and I don't have a following up and an evaluation plan. Sometimes I put a high expectation that I cannot reach it. The annual plans that they are totally put different and far away from the evaluation strategy and the follow-up strategy. Actually, there is one good point. The branches of the council is still working with the DOS style, which is actually done a long time ago. The council in Egypt is working with the Microsoft Windows, but most of the branches of the council are very, very, very weak, and there is a difficulty in collecting the indicators. Turkey is one of the best countries that we did a study. The program is very good. The evaluation and the following up is related to the planning. It is done throughout an independent sector, throughout the NGOs, throughout the donors. The indicators, they are very simple, they are very easy, it is not complicated. The living details and database is very important, because if I'm conducting such a research, if I don't find a trustable information and trustable database, this will be an obstacle in front of me. I need annual database, annual information in order to do such kind of evaluation and following up. I need also to write a report to give a feedback about my work in order to step on the weak points in my plan. There was also that they depend on updated database from among the indicators that they use. The sustainability, if the state or the government is capable of organizing and managing the program after the donors leave the project or not. Then the second indicator is the training skills. Are the trainees use what they were trained on? Do they use what they learned in the training courses? This is actually very important. Finally, or wrapping up for what we said, we have as a subsidy that is supposed to be provided to the poorer and to the most weaker sectors, and to have mobile clinics to encourage the national sector. The loans should be specified to the most needed areas. Training programs that they are set perfectly and properly to train the most vulnerable and the weaker, and to have variety in the means. But actually this does not happen. What happens is unfortunately the contrary. Shall I repeat it again? This is part of the family planning. Quickly I will talk about the population awareness. First of all, where are we? We will see the percentage of the women that they know the sterilization and the different means of contraception. It's stable. We will find a very weak role for the different means of media. This is the percentage of the women that they heard about the different means of contraception from the television, radio, or magazines, newspapers. We will see that is a percentage about 20% from those who are not using the contraception. They go to the health center and nobody is talking to her about the different ways of contraception. She is coming to the health center, so this is a best opportunity to talk to her and then try to conduct some field campaigns. The field campaigns, unfortunately, and to be honest, we don't have updated information, updated database, and that's one of the problems that we faced in the year 2014. But actually I was surprised by the information I got from the year 2008, but actually in distributing from among 1995 and 2008, we were focusing on the poor groups and the less educated sector. In the year 2008, we focused on the medium educated women, and with the that happened. There was weak points and weak percentage in Upper Egypt, and I think that these are the most weak areas where we'd like to go. What is the future for our strategy? But actually we have a problem. We have 23 awareness activities activities with no fund at all. According to this strategy, we have a fund for only 3 activities and the rest no fund at all. Concerning the media perspective, what we found that the social marketing was actually going back. No social campaign for the family planning. When we are doing our awareness, most of the awareness we say use, but it's very rare to say what to use, what's proper for you, what's suitable to you, what's suitable for your age, how to deal with the side effects if happens, and we put all these facts in front of the woman, and she has the right to choose. So here we will see that the percentage of the women that they were said that they were talked about the side effects in the year 2014. And the percentage of the women that they were told how about the different means of contraception were 30%. And actually, the campaigns does not put in consideration the different social standards and the different social cultures. Then we have direct awareness, and we say that the women, they go to the clinics and to the health center, but unfortunately the nurses, they are not capable of doing such kind of awareness. We will see some governorates like El Bahira and El Fayoum, the health centers are very few. Any project among which is under the umbrella of the Ministry of Health, they work in everything. They have lots of responsibility, not only the project of family planning like the bird flu, any project under the umbrella of the Ministry of Health, they work on it, so they have lots of responsibilities. Then we have another problem, which is the funding. It's covering nine governorates. 6 out of the 9, they are okay, and there are some other governorates like Kafr Sheikh El Minya, Sohag. They need such services, and unfortunately the loan don't cover such services. We need also a health care for the women after giving birth to her child. Tunisia and Turkey, they do this. Unfortunately, we don't do this in Egypt. Unfortunately, we don't find any successful steps in this field to raise the awareness for the women after giving birth. We don't, if we talk about the educational perspective, unfortunately, we don't have any kind of awareness in our curriculum. And even if there is a subject, 1 or 2, when we were discussing what is the main target of putting such a subject in the curriculum, according to the Ministry of Education, it has nothing to do with the population problem. So it was better to use to benefit from the professors and from the scientists to address this problem. This is a golden opportunity that it is not taken, because I have a third of the population, almost 21 million, they are students, so I should benefit from this opportunity. How can I benefit from the other countries? There are 6 pillars, beg your pardon, to share information with all the countries, and to open the door for discussion throughout organizing annual conferences, not to address only the parliament or the ministers. No, we should hold annual conferences for the people who actually work in the field of the population sector, and I encourage those people to attend such conferences, to set awareness programs, and to set awareness programs for those who are about to get married, for the married people, for the employees, for the students. there was actually there was no trust between the users and the Ministry of Health. We should build bridges of trust between the users of the different means of contraception and the Ministry of Health, and to depend on the scientific evidence. Actually, Turkey was a leader in this field, and to conduct projects, awareness projects, and to do such amendment for the law. And this what happened in Turkey according to two scientific studies and scientific researchers. So now I grab the attention of the decision maker throughout the education, throughout all the experiments. Tunisia, we're studying Tunisia, Turkey, Iran, part of the educational system. These subjects were actually very important and were part of the curriculum. Thank you very much for listening, and sorry for being lengthy. Thank you very much.